My name is Mohamed Janabi. I'm the Executive Director of Muhimbili National Hospital and Senior Advisor to President of Tanzania on Health Affairs and Nutrition. So yes, we're in Dar es Salaam today, the 27th of January 2025, and we are here for the Mission 300 Energy Summit, which is started today and it will end tomorrow. So it's on the 27th and 28th of January 2025. So the main objective of the Mission 300 Energy Summit in Dar es Salaam is to expand access to reliable, affordable, and sustainable electricity to 300 million people across our continent, Africa, by 2030. So the aim of this meeting is to accelerate reforms, secure finance, and strengthen partnership to drive Africa energy transformation. It's a collaborative effort involving African heads of state, and as you heard from yesterday, 25 heads of states are attending, 10 prime ministers and vice presidents are attending, and private sector leaders and development partners like Dr. Shah, you saw, the president of Rockefeller Foundation, the head of ADB Bank, Africa Development Bank, and the World Bank. And it's held jointly by initiative started by President Samia Suluhu of Tanzania, together with World Bank and Africa Development Bank. So these are the main sponsors of our summit. Now, to me, if you ask me, I'm going to concentrate more on the health part because there's a great link between health and energy. To access to clean and sustainable and affordable energy is very crucial advancing health outcomes. I should say, if you look on the statistics, 9 million people every year in the world lose their lives because of air pollution. If you translate that one, it's 1 in 5 people die in this world because of air pollution. And it's very unfortunately because 99% of the world today is contaminated by air pollutants. So the initiative which President Samia has taken really is to have a clean energy because the target, as you heard in the morning, by year 2030, the objective is to reach 300 million people. That's just 50% of the 600 who require electricity. But for us on the medical side, we are happy to hear this initiative because let's say someone lives in Biharamulo and we are in Dar es Salaam. It's 1,400 kilometers. How am I going to transport the vaccines? Because they are supposed to go under cold chain. How are they going to restore it there? So you'll see how it will improve the health of our people there. Forget about Biharamulo. Here in Dar es Salaam, at Muhimbili National Hospital, how can I run the MRI machines? How can I run CT scans machine? How can we do telemedicine to reach those who are in the rural areas where we talk about equity? Now, you can't reach equity if you don't have electricity. So I really pardon the president for the initiative he's taking. Unfortunately, with pollution, it's dangerous because it starts before you are born. Because if the mother holds unclean air, there is a chance of having a premature baby, which you have to struggle again to. It means it increases cost of running the hospital. You can get an abortion, you can get a baby with deformities, and not surprisingly, you can ask my colleagues, kids are born nowadays with asthma. So while the mother is pregnant those 9 months, inhaling the air which is not clean directly affects the baby. Now let's say the baby is born with all those diseases, heart, asthma. You're increasing your number of under 5 mortality. The people who are going to die under 5 years. So if you improve the air, as our president is advocating, You are reducing the number of mortality rates under the age of 5. Fine, the baby has survived to teenagerhood and wisely decides, I'm not going to smoke cigarettes. So she avoids to smoke cigarettes, but the air is polluted, so her chances of getting lung cancers, heart diseases, and no wonder sometimes when we see the patients at the emergency department, our numbers increase because of such things. But beside that, another biggest fear with unclean energy, the temperature of the world is rising up. As we speak, it's 1.1 degrees centigrade higher. If we continue the same way, by year 2030, we are going to be 1.5. And by year 50, it's going to be 2 degrees higher. No wonder now you see droughts, you see floods. Recently, we had in North America, in the middle of winter, you get strange big fires. And statistics also shows that our lifespan is reduced by 1 year with air pollution. For example, and I'm not talking about faith, I'm talking on science side. If you're supposed to live 70 years, you're going to live 69 years. 1 year you are deprived because of air pollution. So it's something which really, it impacts not only the economy, the social side, it impacts in our health in general. So really, for our country, this is one of the great initiatives saving our continent and the globe in general. But on the other side, as I used to be the chairperson for medical tourism in Tanzania for 4 years, from year 2020 to 2024, last year, you know, we have about 1,500 guests who visited there in Dar es Salaam today. The entire world is watching what is going on. So, and some of the guests, soon after the summit, they will go to Zanzibar, they'll go to Kilimanjaro, they'll go to Serengeti. But beside that, we have a booth at the airport, all the hotels which the guests are, branding our hospitals. Muhimbili National Hospital, Jakaya Kikwete Cardiac Center, Muhimbili Orthopedic Institute, Ocean Road Cancer Institute, and the Aga Khan, because it's a private-public partnership, plus at Julius Nyerere Conference Center. We have a booth there, showcasing what our hospitals can do, from kidney transplant, from bypass surgeries, from neurosurgery, brain surgeries, which we do. And as you know, these are public hospitals. So one, it's very economical, and you can hit 2 things at a time. You can come and get your treatment, and after treatment, go to Zanzibar and take a rest. So that objective of High Excellency, the President, of reaching 5 million tourists by year 2030, I think we are contributing to that number.